Greetings. I'm George Greene, President and CEO of the Hospital Association of Southern California. Thank you for listening to this special edition of our In the Spotlight podcast series, where we discuss relevant healthcare topics impacting our member hospitals and beyond. Today, I will introduce you to a collaborative project between the Hospital Association of Southern California, Communities Lifting Communities, HASC's affiliate nonprofit 501c3 organization and lead on community health improvement initiatives, the Center to Advance Community Health and Equity at the Public Health Institute, and the Los Angeles County Community Health Assessment and Action Partnership, also known as the LA Partnership. The organizations came together in 2021 to identify opportunities for aligned action to address homelessness. The homelessness crisis continues to be a significant structural and societal challenge, and hospitals and the healthcare system are bearing an increasing financial burden for patients with more severe health conditions. Hospitals are required to provide appropriate post-hospital care for homeless patients upon discharge under SB 1152, and additional regulations to address a patient's social determinants of health are anticipated. Other entities outside hospitals have the responsibility and potential capacity to help respond. To date, the goodwill of individuals and individual organizations has not been sufficient to address the problem. Hospital leaders agree that interventions and collaborations are needed with community partners and in the hospitals. The problem of homelessness requires coming together for the common good, commitment to aligning assets across sectors, and strategically focusing on communities where health inequities are concentrated. Today, joining us, I'd like to introduce you to Jonathan Schreiber, Vice President, Community Engagement at Cedars-Sinai, Rosemary Veniegas, Senior Program Officer at California Community Foundation, Kevin Barnett, Executive Director of the Center to Advance Community Health and Equity at the Public Health Institute, and our own Susan Harrington, President of Communities Lifting Communities. Thank you all for joining us today. First up, who is the LA Partnership?
Hi, good morning to everyone. Good morning to George and to the members of the HASC Leadership Committee. My name is Rose Veniegas, and I'm a Senior Program Officer with the California Community Foundation. Our mission is to lead positive systemic change that strengthens counties and communities here in Los Angeles. The LA Partnership is an entity that the Community Foundation has been grateful to support over the years. It was established in 2016 by hospital-based community benefit leaders. And the LA Partnership's mission is to maximize the community health improvement objectives of the county in alliance with multiple public health agencies, over 30 hospitals, and multiple community partners. They promote best practices and alignment with the local community health needs assessments, as well as focus on prevention-oriented implementation strategies. And again, the Community Foundation has been grateful to support this effort and also to be able to partner with Communities Lifting Communities over the past few years.
What are the Homeless Initiative Program activities?
Thank you, George. Great to be with you and colleagues. My name is Kevin Barnett. I direct the Center to Advance Community Health and Equity at the Public Health Institute. The center is a national center, the initial funding from the Robert Wood Johnson Foundation to support evidence-informed strategies that challenge hospitals, health systems, and other related sector stakeholders to come together to develop comprehensive and sustainable solutions to the profound health inequities that we have in our communities across the country. In terms of the specific activities of the homeless initiative being implemented by the LA Partnership, it's important to emphasize an important underlying expectation as these colleagues came together, which is a recognition that these challenging problems did not emerge yesterday and are of such a scale that it's absolutely imperative to come together with an ethic of shared ownership for health, to look at ways in which we can better align and leverage the assets, not only of hospitals, but of other related sectors, including the community development sector and including the public policy arena, to look at ways in which to solve this challenging issue that we face in particular in the Los Angeles area. So with that in mind, an important first step in the process was to have a deeper understanding of exactly what hospitals are currently doing in this arena. So in the process, we first reviewed all available public reports released by the hospitals, the health department, and others in this arena. Then we conducted a series of key informant interviews to really fill in the gaps that we have that would enable us to understand what exactly each of these stakeholders is doing, where, how much, when, with other partners, and how they're beginning to assess the impacts of those efforts. That then provides us with the means for beginning to weave together, scale up, and align these respective efforts.
Jonathan, what collaborative opportunities do you see with hospitals and communities?
Well, it's very clear that there are really 4 areas that were identified. And I think that these were identified by the LA Partnership through collaboration with CASH and CLC. But the 4 areas were really around street medicine, around recuperative care and medical respite. The 3rd area would be affordable housing, which is an enormous issue that we know we can't solve exclusively on our own. And the 4th, of course, is data coordination and best practice learning.
Finally, for our own Susan Harrington. Susan, what is the approach going forward?
We will pursue an incremental approach that allows hospitals and communities to build on collaboration that is occurring and desired. We'll build consensus and align communities of focus for interventions, for example, in those areas previously discussed, including street medicine, recuperative care, affordable housing, and data coordination, working with hospitals and geographic partners. We'll identify and pursue opportunities for co-investment with hospitals, the public sector, and private philanthropy. And we want to invite all hospitals and health systems in Los Angeles County to join us on this important initiative.